The incidence of hyperglycemia has increased significantly in recent decades due to the increase in obesity, the decrease in the level of physical activity, and the aging of the population. What is hyperglycemia, and what causes it? The term hyperglycemia indicates the condition in which there are high blood glucose levels compared to normal values. Hyperglycemia results from increased hepatic glucose production and reduced use in peripheral tissues. The main cause may be insufficient production of the hormone insulin or its inadequate action. Insulin is the hormone produced by the pancreas, which facilitates the passage of glucose from the blood to the cells, thus performing a hypoglycemic action. Hyperglycemia is precisely one of the early symptoms of diabetes mellitus, a metabolic disease that is increasingly widespread throughout the world, especially type 2 diabetes. According to the latest data, in 2021 there are 537 million adults in the world with diabetes, equal to 1 in 10 people, and an increase of more than 20% by 2030 and 45% by 2045 is expected. Also in 2021, diabetes caused 7 million deaths worldwide, about 1 in every 5 seconds. However, hyperglycemia can also be caused by certain pathological conditions, such as Cushing's syndrome, hyperthyroidism, pancreatitis, and cystic fibrosis. Remember that slight fluctuations in blood sugar levels are completely normal and occur in response to the food we eat. In fact, there are reference values for blood sugar, a sort of traffic light that gives us valuable information on our state of health. Blood glucose chart. In physiological conditions, fasting blood sugar, that is after at least 8 hours of fasting, is generally between 70 and 99 milligrams per deciliter, while 2 hours after a meal, it is less than 140 milligrams per deciliter. Between 100 and 125 milligrams per deciliter on an empty stomach, we speak of impaired fasting glycemia, while between 140 and 199 milligrams per deciliter after a meal, we speak of impaired glucose tolerance. In both cases, we speak of pre-diabetes, a real yellow light. If, on the other hand, fasting blood sugar is greater than or equal to 126 milligrams per deciliter, and after a meal it is greater than or equal to 200 milligrams per deciliter, we speak of diabetes and must be confirmed on at least 2 different days. What are the symptoms of hyperglycemia? There are some real alarm bells that you need to pay close attention to. Let's see what the main symptoms of hyperglycemia are. Polyuria. It indicates excessive urine production, which also leads to increased frequency of urination. The kidneys consequently have to work harder to filter and remove excess glucose from the blood. Increased urination leads to dehydration, especially if you don't replace lost fluids, and xerostomia, also known as dry mouth. The urine volume, which is normally 2 liters per day, can reach up to 3 liters in 24 hours in case of polyuria. The urine, being very diluted, will present a very light color. Remember that the color of our urine can reveal valuable information about our health. To find out more, I leave you the video I made above. Polydipsia indicates a state of intense thirst that leads the patient to ingest large quantities of liquids, usually water, higher than the body's water requirements. There is therefore an irrepressible need to drink continuously, without, however, being able to quench the thirst. Polyphagia indicates the uncontrollable urge to ingest large quantities of food during or between meals. In the case of hyperglycemia, blood sugar levels remain high, preventing glucose from entering the cells due to lack of insulin. The body is therefore unable to convert the food you eat into energy, and as a result you will continue to feel hungry. Not only that, polyphagia can be associated with involuntary weight loss. Since your cells aren't getting glucose, your body thinks you're dying of hunger and finds a way to compensate. It starts burning fat and muscle protein at a rapid rate to get the energy it needs to perform all of its functions necessary for your survival. Chronic fatigue. Chronic fatigue, muscle weakness, drowsiness up to a mental confusion are all symptoms that hyperglycemia can cause. This happens because the glucose in the blood is not used properly by the body as a source of energy. Cells and tissues are affected and start to work less, thus making you feel tired and fatigued. Recurrent infection. When blood sugar exceeds certain limits, the amount of glucose in urine, sweat, and saliva also increases. This hyperglycemic environment is suitable for the growth of bacteria, which begin to proliferate and promote various infections throughout the body. Among these we find respiratory, skin, urinary, gastrointestinal infections, and many others. Hyperglycemia favors the dysfunction of the immune system and does so by causing damage to the function of neutrophils, white blood cells mostly present in the blood, and by inhibiting the antioxidant mechanisms, that is, those that have the task of counteracting the free radicals and toxins present in the body. Other consequences include a decrease in the antibacterial activity of the urine, gastrointestinal and urinary motility disorders, neuropathies, that is, impaired peripheral nerve function, and micro and macroangiopathies, eye alterations affecting both small and large vessels' blood. Migraine. Migraine is one of the most common forms of headache and is typically described as a throbbing, intense pain that usually originates in the front or side of the head. High blood sugar levels cause changes in the levels of hormones, such as epinephrine and norepinephrine, which can cause intracranial blood vessels to constrict. After an initial phase of vasoconstriction, a phase of vasodilation follows, responsible for the painful sensation typical of migraine, which is due to the activation of pain receptors located in the outer layer of the intracranial blood vessels. In addition, the body tries to release excess glucose in the urine. Excessive urination can lead to dehydration and therefore the onset of headaches. Blurred vision. Blurred vision refers to the inability to see images clearly, thus not being able to distinguish the smallest details. There is a real loss of visual acuity, and it can affect one or both eyes. Blurred vision caused by hyperglycemia is the result of transient refractive changes due to an alteration in the thickness of the lens or retina, or an ocular refractive error. High blood sugar levels can cause an osmotic swelling of the lens within the eye, resulting in a change in its characteristics and an inability to focus images properly, causing temporary blurring of vision. Untreated hyperglycemia for long periods of time can lead to serious life-threatening complications, which include damage to the eyes, kidneys, nerves, heart, and peripheral vascular system. In severe cases, hyperglycemia causes diabetic ketoacidosis, a potentially fatal complication in which cells, unable to use glucose, use fat stores to produce energy. This leads to an accumulation of ketone bodies in the blood, chemicals normally present in small quantities, which can cause vomiting, mental confusion, and even death. If you notice any of these symptoms, you should contact your doctor. Thanks to a simple blood draw, glucose levels can be checked and glycemia measured, important indicator that allows you to evaluate your state of health and to formulate a correct diagnosis, excluding or confirming the existence of any pathologies.